Let's start with a scenario. You get to the office as usual and set up your desk and start responding to emails while catching up with a colleague about what they got up to last night. Everything is going well as you all go into meetings, discuss strategy and how the company can do better numbers. The meeting adjourns, but as soon as you get up to leave, your colleague tells you that they're feeling a bit quizzy, but just as quickly dismiss their symptoms. As you all leave the meeting room, your colleague collapses into a pile on the floor. There's panic, chaos, and then shortly, paramedics arrive at the scene, but their faces show that there's no hope. A short drive to the hospital and one phone call later, your colleague is no more. Sudden death. This gets you thinking. Your colleague was generally a health-conscious person who was fairly active and was mindful of what they ate. So how did this happen? As puzzling as this is, it is not uncommon. Worldwide, sudden and unexpected cardiac death is the most common cause of death, accounting for 17 million deaths every year. If you put your mind to it, this number points to a very significant loss in human capital to both the government and companies who've invested millions of pula in their education, professional training and growth in the hopes that they'll be the one to improve the country's economy in future. In the grand scheme of things, the impact of sudden death goes beyond just families losing their loved ones. But what causes sudden death, and why has there been an increase in reports of such cases? Pharmacologist and consultant cardiologist Dr. Kiran Bhagat is on First Issues.
Basically, sudden death is just an unexpected one. So it could be a suicide, it could be a drowning, it could be a poisoning. These are all sudden deaths, but they are not the topics that the public want to know about. They want to know about all the ones that appear on TV where a footballer suddenly dropped down or an athlete suddenly collapsed after running a marathon or a swimmer suddenly drowns. So these are the things we want to talk about in terms of the causes of sudden death.
Maybe at this point you could talk us through some of the most common causes of sudden death.
I think the best way to break down sudden death is to break it down by age group. And if we start with the very, very young, the infants, if you like, or the newborns, the causes of sudden death, it's very rare for children to have sudden death. But in neonates, which is basically babies that have just been born, or children less than the age of 1, it's very unusual. And usually the causes of this in the very young are this very hazy term called SIDS, which stands for Sudden Infant Death Syndrome. And we still don't understand why some babies, very small babies, just suddenly die. It is increasingly believed that sudden death in that age group occurs because of the lack of the ability of the brain of the baby to detect rising carbon dioxide levels and to breathe out that carbon dioxide. And particularly if babies are sleeping on their front with their head into the pillow, they may be breathing in the carbon dioxide. This is thought to be the cause of SIDS, as we call it, sudden infant death syndrome, but still it's a hazy topic. In that age group, other things that can occur are matters that have occurred during the development of the baby in the womb. So abnormalities of the heart, abnormalities of the brain, there may be a growth in the brain, there may be an abnormal structure in the heart where the blood is not flowing well, there's mixing of oxygen and deoxygenated blood, unbeknown to anybody. Infections, particularly immediately after delivery, there may be an infection that's not been picked up, or the baby will have picked up an infection if the baby is in a hospital setting, where hospitals particularly are notorious for infection. So these are issues that occur in the very small age group. When you move on to children after the ages of 1, almost up to maybe 5 or 6, again we're looking at structural abnormalities. Infections are possibly common. You can look at undiagnosed epilepsy, where there's an electrical abnormality in the brain and the child suddenly collapses because it was not picked up. And the same with tumors that occurred during the womb and have just continued to develop unbeknown to the mother or without any symptoms, and the child simply doesn't wake up from sleep. Then, of course, there are abnormalities which are much rarer, which have got to do with the circulation, where the baby is not able to keep in the right electrolytes, sodium and potassium, and all these abnormalities where the body is not able to maintain a fluid balance, and that can occur. But these, I must emphasize, in childhood are not very common. We don't often hear about these because they're very rare. The one that is very compelling are the ones that we see more and more today of, and we hear in the news because it makes exciting news, is our sportsmen and sportswomen who, after vigorous exercise or even just unexpectedly collapse on the racing track, or collapse after a football match or during a football match, or after a heavy bout of boxing, for example. And in the athletes, the commonest cause of sudden death is usually cardiac. In the very young, if we're talking about the teenagers up to the age of maybe 21, 22, is usually a cardiac electrical abnormality, or it's a structural abnormality. We know that if you exercise aggressively, the heart tends to slightly enlarge, and if you already have an abnormal heart, say for example an undetected hole in the heart or a blockage in the circulation, or you are that sort of individual who's developed high cholesterol at that age because it's inherited, there may be blockages in the circulation, and these, after vigorous exercise, put the heart under a lot of strain and can cause an abnormal rhythm which causes sudden death. We call that a ventricular arrhythmia, and which is why now most international settings have experts and trainers who are equipped in resuscitating somebody from sudden death with that defibrillator which you see on television, where suddenly shock the heart, because we know that the majority of our athletes who have been working very hard have issues because they've been training so hard. The muscle has become bulky, just like the rest of the body has been bulky, and so often before a major event now, particularly that age group, are screened by doing regular tests such as a resting ECG, where you look at the electrical rhythm of the heart, or you look at the structure by taking a scan of the heart to make sure there are no predisposing factors for sudden death. Then, of course, remember, during a severe exertion of football or running, you may deplete the necessary essential salts. So sodium and potassium, because you've been sweating such a lot. It may be heat stroke if you're running long distance marathons. These are other issues that also need to be taken care of in terms of considering the cause of the sudden death, where they've not adequately rehydrated themselves. And that really is the one that appeals most to the public listener as to why this very fit athlete suddenly died. And it's usually something that was unknown but was there all the time. We then must actually look at the middle-aged group who may suddenly decide that they want to go and take up gym because the doctors told them to lose weight and exercise and get a bit more fit. But they don't take precautions in terms of screening to make sure they're safe to start exercise, or they launch into an aggressive training protocol without actually building up that exercise program, or, for example, suddenly run a 20-kilometer marathon or run a rapid series of bursts on a treadmill or a bicycle, and then suddenly collapse. And in those situations, in the middle age, this is usually because of predisposing, again, cardiac disease is the commonest one, where they've got build-up of cholesterol in the system, they've got blood pressure that's not been diagnosed, and it suddenly escalates after severe exertion. They may have structural abnormalities in the heart, they may have electrical abnormalities in the heart, or they may be undiagnosed in terms of other things that can cause sudden death, such as a very high sugar, or they may be diabetic and they may be taking insulin shots and have taken no insulin shot or too much insulin, and the sugar suddenly drops. So when this age group decides to undertake physical activity, we always recommend they do some basics. Ask themselves, are you taking any regular medication? Are you taking medication that may interfere with your exercise routine? Should you be taking your medication before or after exercise? Are you hydrating well? If you're diabetic, are you injecting too much because you're exercising? You may need more sugar, so your sugars drop. So ask these questions, and if you have any of these chronic conditions, go to your doctor or your clinic to make sure that you are safe, you're well controlled, and they advise you on how to take your medication. In terms of the elderly, of course, this is a completely different bunch, and we almost don't call it a sudden death because often we know that there are pre-existing factors, that, somebody in their late 60s has uncontrolled diabetes or blood pressure, they may have cancer, they may have been taking cancer medicine, they may have an undiagnosed cancer of the prostate or the ovary or the cervix, and it has spread, and then suddenly they exercise and they can't breathe. So often we find that in the elderly it's usually a stroke or a heart attack, it can be a bleed in the brain, or it can be a newly diagnosed cancer which has not been screened. So these are the things one needs to address when one talks about sudden death in different categories, in the very young, in the toddlers, in the teenagers up to the age of 25, the middle-aged and the elderly.
There's another group that maybe we've left out, that's the working class, where somebody, we're just from a meeting or just been talking to a colleague and then they just collapse, into a pile and just die. But when you think about it, this was a person who was very mindful of what they ate. They led a very active life. So in that category, what could be the cause?
In many situations, there is an identifiable cause. And the first thing one needs to ask is, were they taking any supplements or energy-boosting medication or hyper-caffeinating with coffee? Some of these energy drinks, as we've discussed before, contain huge quantities of coffee. And they may contain stimulants. And these, unfortunately, are on the market illicitly. And people use them to maintain their energy levels. Have they been sleeping enough? If you're an executive, are you getting enough sleep? Are you exhausted? And simply exhaustion itself and lack of sleep can cause sudden death because you simply, the body is so tired. The commonest cause in the executive is usually fatigue and stress, lack of sleep, inappropriate eating, over-caffeinating, and energy drinks. And then in that particular age group as well, in the office, it may be that they have undiagnosed conditions depending on their age. They may be walking around too busy to go and check on their health and check their blood pressure or check whether they're diabetic or check whether they have structural problems in their spine where suddenly, there's an issue where a disc suddenly collapses in the spine and it pushes into the spine and causes sudden death, almost like you're being hung, drawn and quartered. So these are the things that occur within an office setting. Usually there is a clue, Another one, particularly in office settings, is people who are asthmatic who have not been taking care of their asthma. They've been ignoring the fact that they need to take their inhalers or take steroids to protect their asthma. They may have COVID plus asthma and they suddenly just can't breathe because the chest shuts down. So often there's a clue as to why that particular individual in the office suddenly collapsed.
So how can one screen for potential risk factors from sudden death?
I think, it depends on the age group, but if we take the main age group, which is the middle-aged office worker as well as the elderly, is to ask yourself, are you aware, first of all, look at yourself. Do you exercise? Are you eating right? Are you overweight? Is there a family history of heart disease, diabetes? Is there a family history of cancer? Are you drinking enough water? Are you taking too many supplements? Are you taking too many energy drinks or coffee? So ask yourself these questions. Are you overstressed? Are you not sleeping enough? Are you exercising? And these really give you a clue as to whether you are somebody who's potentially at risk. Is there a risk? Often in some families there is a history of suddenly somebody not waking up at night. They will tell you that an aunt or an uncle or their father or their grandfather just suddenly died overnight. And that may suggest that there's a history, and in that sort of situation, it's better to be safe than sorry and to go to a doctor so they can at least listen to your heart, listen to your lungs, check your blood pressure and check your sugar. So these are basic things that people can do to ask themselves. I always say it's best to be the CEO of your own health rather than go to a doctor. And so these simple questions will give you insights as to whether you're at risk.
So, doctor, can you point to any early warning signs of impending danger?
Absolutely. The warning signs of danger are unexpected dizziness, unexpected chest pain when you're perhaps just sitting, a rapid flutter in the chest, or what we call palpitations, unexpected central heavy, almost like an elephant is sitting on your chest pain that sort of sits there for a while, and you may ascribe it to heartburn or something fatty or oily that you've eaten when actually it's cardiac. Unexpected dizzy spells or frequent headaches which don't abate from sleep and rehydration. So these are things that can be warning signs that something is not quite right. If you're not on any medication, you're exercising regularly, you're not overweight, you're getting enough sleep, and you're suddenly getting this chest pain, you're getting palpitations, you're feeling dizzy, you're getting unexpected shortness of breath. Even you can notice that, there are marks on your socks at the end of the day, your ankles are swelling. These are signs that you need to take seriously, particularly at that age group, to at least get a baseline test.
Can one avoid sudden death?
Increasingly now, because of public awareness, there is a reduction in the sudden death, largely because we screen. And I think, you'll notice whenever you go to a doctor or a nurse or a clinic, for whatever condition you have, the first thing they do is check your pulse and your blood pressure, whether you have blood pressure or not. So we've taught our health professionals, be they doctors, nurses or auxiliaries, to always make sure the pulse and the blood pressure as standard is done, because we know that the leading cause of sudden death is cardiac, often picks up unexpected blood pressure, unexpected abnormal rhythms. Sometimes the doctor will simply listen to your chest and hear abnormal sounds in the heart. So I think increasingly there is a reduction in sudden death simply because of awareness that they need to be checked up.
This program was brought to you in association with First National Bank of Botswana.
FNB, how can we help you?